Pregnancy typically lasts around 40 weeks, measured from the first day of a woman's last menstrual period. This method means that during week 1, the woman is not yet pregnant. This is the time of her last period before conception. Week 2. Ovulation occurs. An egg is released from the ovary and travels through the fallopian tube, while the uterine lining thickens in preparation for possible implantation. Week 3. Fertilization takes place when a sperm meets the egg in the fallopian tube, forming a zygote. The zygote rapidly divides into a multicellular structure called a blastocyst. Around day 5 or 6, the blastocyst travels down through the fallopian tube towards the uterus. During this time, the cells in the blastocyst keep dividing. Eventually, the blastocyst reaches the uterus and starts the process of implantation in the uterine lining. This implantation is crucial for establishing pregnancy, as it's a common point where miscarriages may occur. The blastocyst starts growing inside the mother's uterine lining, and the inner cells of the blastocyst will develop into the embryo. Week 4. The yolk sac and amnion form, providing the fetus with nourishment and protection. The hormone HCG, which confirms pregnancy, can be detected in blood and urine. And at this point, the embryo is about 2 millimeters long. Week 5. The neural tube begins forming, which will develop into the brain, spinal cord, and backbone. These small buds will develop into arms and legs, and around this time, the heart starts beating. Week 6. Major systems, including the brain, spinal cord, and heart, continue to develop. Facial features, eyes, ears, cheeks, lips, begin to form. The digestive and respiratory systems start developing. Common maternal symptoms include nausea, fatigue, breast tenderness, and frequent urination. The embryo is 2 to 4 millimeters long, with a heartbeat of 100 to 115 beats per minute. Week 7. The brain grows rapidly, and the umbilical cord forms to connect the baby to the mother's circulation. Facial features become more defined, and the digestive tract and lungs continue developing. A mucus plug forms in the cervix to protect the fetus. Constipation may occur due to hormonal changes, so a high-fiber diet and hydration are recommended. Weeks 8 through 9. The embryo is now called a fetus. The placenta becomes active, and the fetus's organs and systems continue to form. Limbs lengthen, and retinal pigmentation begins. Regular prenatal care is important at this stage. Week 10. Most major organs are formed and functioning together. The fetus begins to move, and the heartbeat can be detected. Prenatal blood tests may be performed to screen for genetic conditions. Week 11. The fetus's skin becomes less transparent, bones begin to harden, and growth accelerates. The head still makes up about 1/3 of the fetal length. A first trimester checkup is typically done during this time. Week 12. The fetus is fully formed. Vocal cords develop, kidneys begin functioning, and hands grow faster than the feet. The fetus measures around 2 inches. Morning sickness often subsides, and appetite improves. Week 13. This marks the start of the second trimester. All major organs are developed, and reproductive organs, ovaries or testes, are distinguishable. Fine hair, lanugo, begins growing for skin protection. Usually, around this time, morning sickness disappears, but if your urination is painful, you should be checked for infection by your doctor. Week 14. The fetus measures approximately 8.5 centimeters and starts moving its hands. Maternal energy often improves. Women over 35 are advised to get additional prenatal screening. Week 15. The fetus is about 10 centimeters long and starts hearing sounds and is sensitive to light. The kidneys produce urine, and the heart pumps blood. The baby becomes very active. As the uterus grows, sleeping on the side is recommended to reduce pressure on major blood vessels. Weeks 16 to 20. The fetus grows to approximately 127 to 254 millimeters, 5 to 10 inches. Ears, lips, eyelids, and nails are fully formed. Body fat accumulates for energy and warmth. A waxy, waterproof coating, vernix caseosa, forms on the skin. The baby begins sleeping and waking regularly and can be startled by loud sounds. Around this time, an ultrasound may reveal the baby's sex. Week 21. Your baby's organs, already formed earlier, are now maturing. Fat is beginning to accumulate under the skin, helping regulate body temperature, although overall body growth slows slightly. At this stage, the baby's fingers, toe prints, and fingerprints are fully developed. Week 22. Your baby measures around 27 centimeters from head to toe and weighs approximately 430 grams, more than the placenta. Muscle strength increases, leading to stronger movements and kicks that may now be visible from outside the womb. As your belly expands, stretch marks may appear on your stomach and breasts, which can be managed with moisturizers. Week 23. By now, your baby might start recognizing your voice, showing early signs of sensory development. Week 24. The baby's lungs are now formed and beginning to practice breathing. If born at this stage, there's a 43% chance of survival with intensive medical support. Hair also starts to grow on the scalp. Weeks 25 to 26. As the second trimester ends, your baby's nervous system develops rapidly, enhancing coordination and the sense of touch. The baby can respond to external stimuli, such as jumping at loud sounds or reacting to touch. The heart rate is typically around 140 beats per minute. Melanin production begins, giving color to the skin and eyes. Your baby can now open their eyes, taste, and swallow amniotic fluid. Meanwhile, you may gain between 6 to 10 kilograms and experience symptoms like heartburn, constipation, hemorrhoids, and frequent urination due to increased blood circulation and pressure on the bladder. Week 27 marks the end of the second trimester. The fetus is 14 inches long and weighs slightly over 2 pounds, or about 1 kilogram. The baby is doing a lot of kicking and punching. You may detect the baby makes hiccups, but that is normal and part of fetal development. Your baby's taste buds are well developed, and she can taste what you have eaten a few hours ago. Your baby gains more fat and has eyelashes fully grown, and her nervous system continues to mature. Your doctor will test your blood sugar for gestational diabetes. Week 28. You have now officially entered the third trimester, and you are in the final part of your pregnancy. Your baby weighs about 2.5 pounds and is 14.5 inches long. She opens her eyes and begins blinking. Your baby develops a sleep-wake pattern, and when sleeping, she makes rapid eye movements. When the baby is not sleeping, you can do kick counting to track the baby's movement. Kick counting helps you assess your baby's well-being. How long does kick counting take? Usually, you count 10 kicks or 10 movements within the span of 2 hours. If the baby is making no movements or fewer movements, contact your doctor. At week 26 through 28, your doctor will check whether you are Rh positive or negative. Based on the results, your doctor will decide whether or not you need a RhoGAM shot. Week 29. Your baby starts to gain weight faster than before. At this point, about 20 to 40% of pregnant women may develop varicose veins. This condition is caused by 3 factors. First, the increased blood volume. Second, the hormonal change. And third, the pressure on the veins. The varicose vein may contribute to the development of hemorrhoids. Week 30. The brain matures most rapidly around this time, and the baby starts regulating its own body heat and opens its eyes widely. The bone marrow becomes the primary site of red blood cells production. At some point in your pregnancy, you may experience hyperpigmentation or melasma, which is caused by the hormonal changes, such as increased estrogen and progesterone. Week 31. At this point, most development of the baby's systems is complete, and it starts gaining weight rapidly. Your baby can process information and respond to sound and noise. Week 32. As your baby adds fat to her body, her skin is no longer see-through. Your baby is about 45 centimeters long and may weigh about 1.7 kilograms to 2.2 kilograms. As you get closer to your due date, your baby will gain half a pound of weight a week. Week 33 through 36. This is your 9th month, including the 2 weeks before your conception. Your baby's bones get harder, but the skull bones remain soft to enable the baby to go through the birth canal. The vernix, the lipid-rich substance that covers and protects your baby's skin in the womb, starts to get thicker. Most babies move into a head-down position to get ready for labor and birth. Head-down, face-down position, with the face slightly on one side, is the most common. It is called cephalic occiput anterior. But there are cases where babies have a head-down, face-up position, just like this image. If your baby is not yet in a head-down position, by the end of week 36, you will consult with your doctor. The baby now fills most of the space in the amniotic sac. At this point, the baby's brain weighs only 2/3 of what it would be at birth, and it continues to develop. The baby's protective lanugo hair disappears, but it has hair on the head. You will likely feel a lot of movements, stretches, and kicks in your belly at this stage. If you notice that your baby is not making the usual movements, contact your doctor. Week 37. Your final month starts, and your baby's head may begin going into the pelvis, and you may feel a little uncomfortable in the final stretch of your pregnancy. You could go into labor mode at any time. Your doctor may advise you to perform a kick count to monitor your baby's movement. Week 38. The baby's size makes you uncomfortable as the baby gains half a pound per week to grow to its final size. If the pregnancy is healthy, wait for labor to start on its own. Week 39. Congratulations! Your pregnancy is now a full term, and your baby is ready to see the world. Week 40. This is your due date week. Your baby is now about 51 centimeters long and 3.6 kilograms in weight. Expect to experience the signs of labor. Don't be worried if your due date comes with no signs of labor. The due date is simply an estimate of when your pregnancy will be 40 weeks. It doesn't predict exactly when your baby will arrive. Many people give birth before or after their due dates. Some of the labor signs include 1. Frequent cramps with increasing contraction. 2. Pressure in the lower body. 3. Loss of mucus plug, leading to amniotic fluid discharge. Congratulations! You are now welcoming your baby to the world, and the world revolves around your baby. Thanks for watching.